Welcome everybody. So I will go ahead and as people are coming in, get started, and I'm going to introduce our speaker, and then I'll let her take it away from there. And like I said before, if you do have questions for her or for us, please put them in the chat as we're going along. So we're really excited to welcome Dr. Sharon Tan to give us this presentation titled Working with NICU Families at the Hospital and at Home. Dr. Sharon Tan is a licensed clinical psychologist in the state of California for almost 10 years. She has experience providing therapy services across all ages and currently works part-time as a psychologist on the perinatal and pediatric palliative care team at Miller Children's and Women's Hospital. She is also on the multidisciplinary team of the Perinatal Connections program, which provides support to mothers of high-risk pregnancies, often supporting moms coping with fetal abnormalities. She was a part-time psychologist in the NICU at Miller's for 2 years prior and enjoyed supporting families who had infants with medical complexities. Dr. Tan has had extensive experience in the community mental health settings as well, where she provided training and supervision for services to children birth to 5. She is a graduate fellow from the Infant Parent Mental Health Postgraduate Certification Program from the University of Massachusetts and was trained by Maternal Mental Health Now, 2020 Mom and Postpartum Support International on maternal mental health assessment and treatment. Dr. Tan is currently on teaching faculty with Maternal Mental Health Now. She is also a California-endorsed infant, family, and early childhood mental health specialist and is passionate about helping young children thrive through nurturing relationships and strengthening communities by building strong families. She has a passion for helping parents prepare for and transition to parenthood. She is trained in infant massage and Gottman's Bringing Baby Home program. Dr. Tan sees clients in her private practice in Southern California, located in Pasadena and Brea. Dr. Tan is a presenter, a consultant, a therapist, but the title she is most proud of is mother of 2 lovely daughters. So please join me in silently from your muted phones welcoming Dr. Tan to this presentation. Thank you, Dr. Tan, for being here today.
Thank you for the introduction, Martha. Are you guys hearing me okay?
We can hear you. You sound great. Thank you.
Okay, wonderful. Good morning to all of you. Again, feel free to put your questions in the chat box. And I thought today that my goal would be some of these objectives, but really my hope is that to help you be able to help our NICU families is really to take you on a tour from what gets patients and children in the NICU, what the experience is like, preparing for discharge, and then kind of what the going home is like. And again, I don't know if some of you have had NICU and NICU experience yourself. I would love to hear kind of how any of this resonates with you. But I think if you are able to identify the sources of stress, I think then we can practically be able to help support and be able to be wise about kind of how we're going to intervene and support these families. So I am going to be talking about the sources of stress at certain points in the NICU journey, and we'll kind of have you come along on the journey with me. So my goal is to kind of just give you a sense now at the start of the NICU journey what that's like. And I do have on my PowerPoint slides a picture of the roller coaster for a reason on every slide. So a lot of parents do describe kind of the NICU journey like being on a roller coaster. But each year, 500,000 babies are admitted into the NICU, and you'll be surprised to know that they're not just preemies. More than half of the babies that are admitted are full-term babies, but with special medical needs. So let's just kind of get a sense of what are some of them that you don't have to be a medical doctor, but I think just having a sense, especially of kind of some of the conditions that are treated, and some of them life-limiting, some of them really kind of touching on kind of life and death, which is a significant source of stress for parents. So these are some of the conditions. Thank you. That might be somebody that.
Sorry, Dr. Tan, 1 second. If everybody could please put their calls on mute. We're still getting a lot of background noise. So if you just make sure you mute yourself, that'd be great. Thank you. Okay. Sorry, Dr. Tan, keep going.
That's okay. So I think the main things I want you to kind of get from this slide is that, especially for premature babies, some of there's a lot of complications medically that can happen. From the main thing is their lung breathing difficulty, which will be, and I'll talk about parents.
Sorry, Dr. Tan, I'm sorry to interrupt. Hi, everyone. We're still hearing a lot of background noise, and we're hearing a lot of side conversations on top of the presentation. Can you please make sure to mute yourself? We can do that on our end, but it's out of respect to the presenter and everyone else on this call. Okay, great. Thank you, everyone. Sorry, Dr. Tan, I just want to make sure I can
no
hear
worries. Thank you. All right, so again, I put this up there. The main ideas for you is to just that, especially for premature babies, lung conditions, heart conditions, brain injuries that are pretty common, and sometimes can set the child up to be kind of a medical critical condition. And also to just kind of give you a sense of all the people, the multidisciplinary team that is helping the family in the NICU, including, I'm sure, some of you. But I think that the value of being able to connect with some of these disciplines might be helpful for you, especially if you are helping families post-discharge, or even getting to know them while they're in the hospital. So just for those of you who maybe are not as familiar with the NICUs, there's the NICU doctor, the neonatologist, there are nurses, nurse practitioners. Sometimes, although few and far in between, there are psychologists, but more often than not, there are social workers that are helping with the mental health aspect and case management pieces. There are occupational therapists, physical therapists, respiratory therapists, lactation consultants, hospital case managers, pharmacists, peer support specialists, and child life specialists. So again, there are just so many people that the parents encounter that oftentimes they can't keep track of kind of who has talked to them, especially on the early days of being in the NICU. So I'm going to show a quick clip of a NICU mom, ex-NICU mom talking about her NICU journey experience. And we'll kind of take a few notes from there and then kind of delve deeper into kind of some of the stresses in the NICU and maybe some ways that we could practically support them.
So we were talking about before being isolated. Yeah. And it's funny because the name of an incubator is isolate. When your baby is in the NICU, right? Like that. And yes, of course, your baby is isolated from each other. But what ends up happening is that you are isolated. First and foremost, you're isolated from your baby, which is excruciating because you can't just touch or hold or participate in any care sessions. You can't mother your own baby. You have to ask a nurse, can I touch the baby? Can I speak to, can I talk to the baby? Can I help you change a diaper? Can I do this? It's your baby. Your baby's crying and you can't just pick up your baby. And you can't be the source of nutrition, comfort. You can't do any of those things. So you feel like a failure right away. And you're also likely recovering from some type of traumatic in any capacity. So you're feeling that your body failed you. You couldn't stay pregnant. You couldn't do this, right? Or maybe I did this or ate this or did something, and I'm the reason why my baby is sitting here, and now I can't mother my baby. I really, really struggled with that. And maybe because I knew what was supposed to happen. I knew at least, that fairy tale image of you get to hold your baby by the butt, you get to feed your baby when they are, hungry, you get to do this, you get to hold, and it wasn't like that whatsoever. So you're isolated from the beginning. And then what I noticed, and it took me almost 2 years to realize it, the worst part of the postpartum period for me was when my daughter came home from the NICU. Yes, it was isolating in the hospital and it was excruciating, but when you're home, you're alone. And even if you have the support system around you, you're still stuck in your home. You're not able to go out when you feel like it, or go out for coffee, or go get your nails, or even just go to a store. If your baby has equipment or has medical needs, can't be around a lot of germs. And so I really was depressed, and I didn't notice it. I never struggled with any kind of here and there breakup or something, but nothing really, nothing like that. And I think the worst part for me was I wasn't educated. I didn't know. Why am I angry every single day? She's here, and you'll get comments like, well, she's here, she's happy. Yeah. She's like, why are you happy? Right. That we went through and deal with. And I was very to other kids, and when they went to bed, in fact, I put a bed in my daughter's room in the nursery, and I stayed there for months. I was so afraid she would stop breathing or choke, or I was feeling guilty that I wasn't able to be with her all the time, and from the beginning that I had to make up for it and something, and there's a million other thoughts. But the postpartum period after she was home, so it was month 5, month 6, month 7, month 8, that's when I felt it. And some people are healing and feeling better. I was getting worse. And I said, I mean, I think it took 2 years for me to feel better. And what worked for me was writing. And I've never been a writer, but I really had no other outlet. I had no one to really talk to about it that understood, or I wasn't willing to, probably is the case, talk to people about it. I wasn't good at asking for help. I handled everything. And so it was no different. Yeah. And I myself, how did I feel that?
Okay, so I mean, that gives you a pretty good sense, but there's going to be a recurring theme all through, I think, the family's NICU journey. And I think the theme that most stands out from this conversation is just how overwhelming, how much it pulls out from the parent, that they are a failure already because they might have a premature baby or a sick baby. And also I think that they can't do the regular parent things to comfort and soothe and really develop their identity as a parent. And I think hopefully, because I am hoping, and I'm again have such, this is such a privilege for me to talk to all of you who are kind of home visitors and supporting parents as coaches, that there's so much support that's needed, because the effects and the long-term consequences of being in a NICU really can last for years. And so the support is crucial after they go home. And kind of that, and this mom talked about not being warned about kind of what was happening, and the sense of having to kind of be so afraid to kind of stay in the room. We're going to kind of hear that as well. So there is so much stress that goes along with being in the NICU itself, just starting out, and then the carryover, I think, when they go home, that I just want to go into a little bit of detail about some of the stresses in the NICU, because I feel like some of that will probably be seen when they go home. Some of it maybe not as clear in the NICU itself, but there are kind of these stresses that maybe have accumulated over their journey. Again, often described as a roller coaster with unexpected highs and lows, that it might show up when you actually are in contact with them. So the first source of stress is kind of what we call the intrapersonal, or really just kind of in the baby. And moms often talk about, and dads actually, how those experiences of watching their baby turn blue or stop breathing, or seeing their baby in pain, or having constant kind of interventions done to them medically is kind of a lot of stress, and they develop a lot of anxiety about their infant's well-being, and I think it's often quite traumatic, especially those who have seen their baby needing kind of blow by, or just kind of just that they stop breathing, and they can see the stats because the babies are connected to the monitor of oxygen going down, or heart rate going down. Then I think the other source of stress for you to kind of be aware about is the interpersonal stress. One source of interpersonal stress is that with the baby, I think this mom talked about it quite eloquently, this kind of being separated from her baby, feeling helpless, not knowing kind of what to do, being alienated at bedside as a mom, having to ask permission to kind of provide care sometimes. I think a lot of nurses are excellent, and they're inviting the parents to come in, which is a crucial step. But really, it's challenging in the NICU environment to establish your identity as a parent. And then the other biggest source of stress really is kind of communication with staff or medical team. And oftentimes it could be a source of stress, or it could be really a source of a protective factor. Because when things are going well, let me just tell you, parents feel like they start to be confident about what they're doing. Maternal stress decreases. They're feeling super supported at bedside and heard, and that they feel like there's trust in that there's someone, a nurse that cares for their baby, who's taking care of their baby when they're not there. On the other hand, it is a significant source of stress when there is communication conflict, communication challenges between parent and bedside staff, particularly bedside nursing. And parents talk a lot about, especially towards the end of the NICU journey, really wanting to kind of be more involved, and some conflict arises with bedside staff. So that's going to be one, maybe, I think, to begin to support parents and beginning to negotiate how to advocate, how to talk about what they would like for their baby, how to kind of continue to work through challenges with trust with bedside care. That would be super excellent. The other piece is the extra personal, where life goes on even if you have a baby in the NICU. And so the source of having to meet the daily needs of their other children, childcare for the children while they come visit the baby, and then financial strain, because oftentimes if they are at the NICU and juggling all of this and recovering themselves, they're not able to kind of go back to work as soon as they would like. Another piece that I want you guys to hold on to, especially when you're assessing for trauma when they are at home, is the impact of the environment. I don't think that parents are aware of how much the environment impacts them, the sights and sounds, the machine.
Sorry, one second. Please, everybody mute yourselves. We just had a lot of background there. I'm going to also force mute everybody too. Thank you, Dr. Tan.
It's okay. And then I think the environmental stress of kind of being the sudden noises and the monitors, the noises. I think there's a lot going on if they're in an aisle that has babies that have more complications. They are seeing a lot, sitting there watching. That I think there's secondary trauma to kind of think about. Not being kind of close to the restroom, things like that have been not being able to stay with the infant. Those are kind of environmental stresses that I think go on a lot. So just to have you know, I think that what happens to all of the stress in our brains and our bodies, our brains have a lot of ability to recover, to adapt, to be resilient. But I think the idea of toxic stress is something to hold. I think it's more the accumulation of stress that is kind of the part that kind of gets to NICU parents. So just a quick overview of kind of stress real quick. I know we all know about positive stress, where it's like a test or a meeting new people, and we kind of like, it amps us up to kind of do our best. And then there's a bigger events, I would say, that are tolerable stress. And oftentimes at the start of the NICU, parents often kind of are in this category of tolerable stress. Yes, this is something big that has happened. Yes, this is changing kind of my whole world. But I'm able to adapt, I'm able to cope, I'm able to kind of come visit, I'm able to arrange my life to support my baby. But I think over time, and often those families that are there for 2, 3, 4 months, it becomes a little bit more in the category of toxic stress, where it's chronic stress in all of those stresses that I talked about that accumulate and become toxic. I don't think I have time to go over kind of some of these toxic stress patterns, but I just want you to know that they are there. Where stress happens too often, right? Every time they go to visit their baby, something happens to their baby medically, and they are in heightened stress response, and it just kind of happens every time. Often parents will say, "Oh, it's really hard for me to go back and visit because every time I go, it's bad news or something bad happens," or that they take a really long time to recover. So I know parents, as some dads talk about, just kind of going, and then they get so stressed out that for weeks they don't go back, and then nurses at bedside get very concerned that the parents aren't showing up at bedside, or the stress of not being able to adapt to kind of the environment, or being in a stressful place like the NICU, where every time they go to the NICU, they are getting stressed out. This is particularly true for parents that have had previous NICU babies or previous NICU infant losses. This is huge. Every time they go, they might be triggered. And then the inability to recover back to baseline. So these are the families I think of that are super high risk, especially young teen parents or parents that have had substance abuse history, or just ineffective coping, where they cannot get back to baseline and be able to come back and re-engage with their babies at bedside, and they cope with the being in this kind of anachronic stress by using substances or by kind of staying away and doing other maybe unhealthy ways of coping. And they're not able to sleep very well either. So a word on grief and loss. I just want to kind of talk about this real quick, because part of the stress connected with the emotional stress, at least connected with the NICU journey, is this idea of they're grieving, parents are grieving a lot. And if you might indulge me, and this is something that I know our social workers use at our hospital, it's the story about Welcome to Holland, to kind of try to capture the idea of grief and loss for parents. And this is how the story goes. I'm often asked to describe the experience of kind of raising a child with disability or being in a NICU. So when you're going to have a baby, it's like planning a fabulous vacation trip to Italy. You buy a bunch of guidebooks, you make your wonderful plans, the Colosseum, the Michelangelo, the gondolas in Venice. You learn some handy phrases in Italian. It's all very exciting. After months of eager anticipation, the day finally arrives. You pack your bags and off you go. Several hours later, the plane lands. The stewardess comes in and says, "Welcome to Holland." Holland, you say? What do you mean, Holland? I signed up for Italy. I'm supposed to be in Italy. All my life, I've dreamed of going to Italy. But there's been a change in the flight plan. They've landed in Holland, and there you must stay. The important thing is that they haven't taken you to a horrible, disgusting, filthy place full of pestilence, famine, and disease. It's just a different place. So you must go out, buy a new guidebook, and you must learn a whole new language. And you will meet a whole new group of people you would never have met. It's just a different place. It's slower paced than Italy, less flashy than Italy. But after you've been there for a while, you catch your breath, you look around. You begin to notice that Holland has windmills, Holland has tulips, Holland even has Rembrandts. But everyone you know is busy coming and going from Italy. They're all bragging about what a wonderful time they had there. And for the rest of your life, you will say, yes, that's where I was supposed to go. That's what I had planned. And the pain of that will never, ever, ever go away, because the loss of that dream is a very, very significant loss. But if you spend your life mourning the fact that you didn't get to Italy, you may never be free to enjoy the very special, the very lovely things about Holland. So I read that and spent some time with that, because I think some parents really resonate with that story about being just kind of the sudden change and shift of now they're in a NICU with their babies. It's not ever anything they planned for. And now how do I survive and adapt to being in the NICU environment? There is so much that they're learning, not just kind of the NICU rules and kind of the people, the medical pieces. A lot of parents, by the end of their 3, 4, 5 month stay, they speak like they are medical professionals. They know all the terms, they know all the things. So they're really learning a new language, engaging with a whole new group of people. And I think the idea of wanting kind of, when they're pregnant, wanting this child that they're dreaming of, having a child in real life that is in the NICU sick. And then oftentimes I put their feared child, because I think oftentimes when the children are sick, and this is a fear that they carry with them, parents, for a very long time, and that might be something to unpack and help parents kind of understand or even be aware of, is this fear of the feared child, the child that's sick, the child that has delays, the child that might not really catch up, the child that has to live with disabilities. And I think also kind of this loss of not just their pregnancy, but the loss of the opportunity to develop their identity as a parent, due to all the kind of restrictions at bedside and not being able to kind of to feel helpless about helping their baby, really kind of impacts them. And I want to say a word about grief can also come up each time, especially when parents start to get connected to their babies in the NICU. You'll see more and more distress about leaving their babies. So the grief every time, and the loss of kind of having connected with the baby in NICU and having a good time holding them, and then having to be pulled apart and to have to leave their babies over and over again. Again, the idea of the accumulation of chronic stress. And really, they might not feel like they're very, you know, that they might feel like they're handling their stress okay. If you ask them, they might even say, you know, I'm kind of okay. We're handling things. It's stressful, but we're okay. But further down the line, and this is where I think regular check-ins for those who have signed up for programs, home visitation programs, it's the regular contact and check-in to see, hey, how's your stress now? That would be really, really huge in kind of helping identify when they've maxed out and they're getting to the space of toxic stress. I think, and I wanted to just kind of throw in here, especially with the pandemic, something to think about is that babies in the NICU often, especially premature babies, have kind of premature lungs that set them up for kind of a lot of infections and diseases. And so I think there's a lot of heightened anxiety now over the coronavirus with babies. Really decreased amount of support, social support. Only one visitor is allowed at bedside. And parents often have to switch off when oftentimes previously they would have mom and dad both at bedside, and so they were able to support each other if anything stressful happened. There are restrictions in the use of kind of their social media to kind of stay in touch with their families. They have to wear masks all the time now, so I think that's a significant barrier in terms of feeling safe and social support. I put here nursing limitations. I think that oftentimes consistency and predictability is huge in being able to counter kind of these stressful times. And oftentimes I think with the pandemic, I know that there are nursing kind of limitations going on that might not afford that. A lot of our NICU volunteer programs have stopped. So we have a cuddler program in our wonderful hospital at Miller's, and all of that has stopped. So even the babies kind of support socially and physically are also decreased. Moms talk about not being able to have baby showers or medical updates provided to only one parent at a time. And I think I want to say here, because there's only one parent allowed at bedside, the issue of supporting parents to advocate for translators, especially people that are, English is not their primary language. Again, we talked about communication with staff being a significant source of stress. You layer in the pandemic, one person at a time, layer in kind of language issues, and you get really kind of a brewing storm of a lot of stress. Especially I've seen kind of for parents that have been Spanish speaking that have not been able to access interpreters. I think that a lot of support would be helpful in helping them understand the system and the environment to help them access the resources they need to be able to talk, to communicate with their medical team and staff I cannot stress how important that is. So the effects of stress, if you think about all of this and the accumulation, again, I'm going to stress the accumulation of stress. It's no wonder that it affects them ultimately physically with fatigue, decreased milk production, but often parents also get sick, which then exacerbates their feeling of separation and isolation and not being able to connect and be with their baby because they're not allowed on the NICU if they are sick. In fact, they're not even allowed in the hospital at this point. We have checks at the door for people that are sick. And then the emotional and psychological, of course, is going to be something that we monitor throughout their NICU stay, but also something that I think will be helpful for everyone to keep monitoring all throughout, even after they leave. A lot of parents talk about cognitive challenges with stress, not being able to retain information, needing information to be repeated over and over again. Some parents get super hyper focused on kind of the minutia of numbers on the monitor and get very locked into the way that they're thinking, and which could use some support in helping them to be more flexible in the way they're viewing things. I think spiritual people do kind of start to wonder about life and death issues, especially watching their child kind of almost at the brink of death. And one parent even said to me, did I do something bad to someone? Is it bad karma that my son is in the hospital at this point? And of course, the relational stress, especially at this time, the marital stress, the conflict with extended family not really knowing how to support them, feeling like they're a burden with the sick child, and the stress of not feeling bonded to their child. So I'm just going to give a quick overview because I don't know how many of you are actually able to kind of go to the hospital and be in the NICU unit. I want to spend our time, I think, better served in kind of preparing for discharge and after discharge, where I think that a lot of your support and interventions could work. But mom, these are all kind of researched interventions that have shown to be helpful. And I think this mom that we heard in the clip previously talked about writing. So journaling is huge. So if you guys have a stockpile of journals, that blank journals, that would be awesome to have handy to hand to parents that seem to be really, really stressed. That is a way that would help them kind of, or any kind of expressive, but writing kind of is more kind of helping to kind of put a story together, which is helping to process. Parent support is huge. So if there's ways, I think, for parent coaches to make contact with them while they're in the NICU, I think that's wonderful. I think I'm going to put out there, I don't know the criteria and limitations of the programs you're in, but it takes at least 3 contacts, or three benign face-to-face contacts to help you not become, to help you be less of a threat as a novel kind of stimuli to the parent. And I think that's going to be super helpful if at if there's any possibility to do that, even if just to show up real quick, hi, how are you, and then leave 3 times before they are discharged. I think that will help with the post-discharge follow-up. Parent education. I think there's a lot of work about supporting parent-infant interactions. I'm going to talk about that a little bit. A lot of family education pieces about development, about baby cues, and then family-centered care and kangaroo care. So I'm gonna now just kind of, I know I'm flying through a lot of things, so please kind of write in your questions about what you're seeing the stresses are while families are in the NICU. Have you been able to access families? Are they willing to talk to you? What are some of those barriers? Please kind of think about those, and maybe I can answer some of those questions as we move along. But bonding in the NICU is huge. I think that this is idea, and we'll talk about in a little bit, about how to support bonding, how to include the parent more in the NICU process. And this is just kind of some of the things that parents say, impressions of parents while they're in the NICU, that it feels like this is not really my baby. If they don't really feel like a parent yet. I'm remembering one mother who had a premature baby who for at least a month or two would consistently and faithfully come to bedside. But in talking to her, she would say, you know, I don't feel like she's my baby. And she didn't feel like she was a mom until she actually held her baby, which was, I want to say about 6 weeks out, because the baby was so fragile. And until she had a skin-to-skin kind of a contact with her baby, was only when she felt like, okay, this is my baby. I'm actually a mom. Other than that, it just felt pretty surreal to her. So how do we help support this? I think it's crucial because at the end of the day, it is the parent who will be taking care of the baby. And it's that relationship that's going to be key in helping the baby continue to grow and be well taken care of. So these are just some ideas. I think it really does come down to the parent's own stress and emotion regulation, which I think if they trusting you, and if you're part of their social support, helping them recognize what helps them when they're stressed, what helps them recognize when they're overwhelmed. So what helps them to be present at bedside, what helps them to be the kind of parent they want to be at bedside. Those would be kind of important questions to help them process their bond or the lack of bond, and to be able to talk about it. What's getting in the way of that? Maybe it's grief or trauma. Maybe it's a fear that their baby's going to die, and so it's kind of like, I don't want to connect and then feel the pain of losing my baby. But being able to have a place to talk about it with someone is going to be huge. Definitely encourage, if you're kind of a nurse, to encourage as much as possible when they're present, if it's possible for the baby, to kind of touch the baby, to have some kind of skin-to-skin contact, whether even if it's just putting their hands and being able to contain their baby, or putting their hands gently on their baby's body while they're there and the baby's in the isolette. And I think further on, helping the parent feel empowered as a parent by bedside. So I cannot stress how important bedside staff is in terms of not just encouraging breastfeeding, but also kind of helping the parent recognize, read the cues of their babies and feel empowered to be able to kind of soothe and comfort their baby. And also be able to be aware of kind of the relational process that's happening in their daily caregiving, whether it's feeding, bathing, changing diapers. Those would all be kind of ways to help them feel connected, be in that moment, not just kind of doing the functional care, but kind of really taking it in as a way to connect. So I like Bruce Perry's idea of what he talks about: regulate, relate, and then reason. I don't know if some of you have kind of heard those phrases before, but really, if I'm not regulated as a parent and I'm stressed out every time I go into the NICU, I'm not going to be able to relate to my child or my infant in the NICU. I'm going to be stressed out, or if I'm there and the medical thing, the machine stress me out, I'm not going to be able to be present to really kind of connect with my baby. And so we really want them to get to a place in the NICU when they're able to relate, and same goes for when they're home too. And then be able to take in, after they are able to connect and be present with their baby, to take in all this information medically that's given to them as updates at bedside. At the end of the day, it's really helping them just kind of take each moment and to breathe. Are there questions at this point? I don't see any questions at this point, so I'm going to keep going on. I think just to kind of go over the protective factors real quick, communication with staff is huge. So I think skills, communication skills, assertiveness skills would be wonderful in supporting families in this space, especially bilingual families or monolingual families would be, I think that's a huge point of intervention that you guys can support families with. What we call kangaroo care, skin-to-skin holding, is also wonderful, encouraging parents to be able to do that. And I think social supports, and especially in this time of our pandemic situation, how do they get social support? Who are their social supports? And I think what I'm finding is that because parents have lost kind of the external ways to cope with stress, they can't run, they can't go out and walk around in the mall or whatever, that oftentimes they start to get more overwhelmed and the stress is heightened when they need to kind of access their social supports in a more virtual way, but also kind of start to build up internal coping skills. So I think that's going to be huge in terms of helping parents develop internal ways to cope. So I've listed some reflective questions that you might be able to use with parents that are in the NICU, and I would really want to highlight the ones that I think support bonding and their awareness of stress. So I'm going to pause for a second and check in to see if we have questions before I move on to the next section. Martha, are there any questions at this point?
So we do have one question in the chat. It says, what about encouraging parent to talk, sing, and read to the baby?
Most definitely. And I think that goes into just kind of helping parents feel like they're a parent at bedside. And I absolutely would encourage you to have parents access resources. So there are child life specialists that can actually offer books. There are music therapists that could help them learn ways to sing, and not just kind of sing and talk, but also as they do that, recognize the cues of their babies when their babies are overwhelmed. So definitely encourage parents to sing and talk, but I think the goal is to help them to learn to begin this dance as a parent with their child. So if they do it with the physical therapist and the occupational therapist, the child life specialist and the music therapist, they're singing and talking and learning as a parent. When is my baby overwhelmed? When are they stressed? How do I kind of do this dance as a parent with a preemie infant? So absolutely encourage that. But I would absolutely kind of call on, hey, is there a music therapist that you can kind of show up? When do they do their sessions? Maybe you can show up and learn kind of as they're singing to your baby, kind of what are they looking at so they can learn. So I would definitely kind of encourage that and if possible, help them do it with a professional in the NICU that might be a specialist in that area. Are there any other questions? Maybe one more, and then I'll move on to preparing for discharge.
Sure. So we do have one more question in the chat too. It says, are there any empowering books written to parents that have babies in the NICU? Do you know any, and do they exist?
Empowering books. I think I listed in your resource page a book, and I'm going to pull that out at this point and tell you. It's going to be in your handouts and resources at the end. Parenting a Premature Baby and Child, the Emotional Journey. And I think there's definitely other books that are more biographical that have been written in terms of kind of supporting your baby in the NICU. But that one I think is the most empowering because it really gives you an overview. It's a pretty thick book, but it gives you really a lot of information about what the journey would be like that would give them anticipatory guidance. And if you want a few more books, please email me. My email is also on the list, and I can give you that. I can give you that. Give you a few more books to look at. So I'm going to move on, if that's okay, Martha, to kind of the next section of preparing for discharge.
Sure, Dr. Tam, if really quick, I will say some people's emails did bounce back the handouts, and I'm going to send them again at the end of the webinar. So don't worry if you didn't get those yet, just so everybody's aware. You will get them. I'll send them again.
Yeah.
Thank you.
And also, I think there were 3 other separate handouts that I sent, separate from the slide. And one of them is called the NNNP Bonding with Infant handout, which gives you, I think, a lot of information, especially during this pandemic crisis, kind of ways to continue to bond with their infants in the NICU. And I think the most, if I might say, the most empowering thing to babies, to parents with babies in the NICU, is talking to other parents. So the parent support piece is in being able to empower them. I think a lot of moms I know go on online groups, and they get a lot of support and empowerment through hearing other people's stories. I don't know that some parents do kind of want to read, but a lot of parents are so stressed and overwhelmed with all that's going on that really just being online and hearing some of the story is really helpful and empowering for them. So I want to just talk real briefly about kind of preparing for discharge, because that has direct bearing on adjustment back home when they eventually leave the NICU. And one of the pieces is not feeling confident about taking care of the baby at home, which I think has to do with a lot of the preparation for discharge, disagreement with the medical team about readiness for discharge, that their baby is ready or not ready to discharge, lack of resources or struggles, for insurance issues, getting equipment, stable housing, having to find special formula and pay for that. And then I think overwhelmed by the number of medical follow-up visits needed are some of the preparations needed. Just so you know, parents that don't feel like they're ready, my concern is really that there's already a high rate of hospital readmissions from preemie babies, but even higher rates of hospital readmissions for parents that don't feel ready. Pretty common for within the week after discharge that parents kind of bring their babies back, either to the ER or their babies are readmitted again. Not having follow-up with primary care, with early intervention kind of programs, infant feeding and health problems, babies that become failure to thrive, people experience higher stress, and then not being able to just kind of manage the day-to-day. So this is, I just am listing very quickly. I'm not going to spend too much time in this arena because this really is some of the areas. I just wanted to give you a sense of some of the areas covered pre-discharge that should be covered for all families that leave. And a lot of times the bedside nurse is the one that kind of helps the parents go through this pre-discharge checklist and make sure that all of this is covered before they leave. Of course, there's a lot of checks to make sure and criteria that the babies are ready for discharge physiologically, that they're stable. But I think that an idea that we want you to hold is that discharge begins at admission. So really, we try to kind of support our nurses to kind of practice what we call family-centered care, in working with families right from the beginning. They're already starting to prepare the parents to feel confident and to learn skills to take care of their babies, not just the regular parent day-to-day baby care, but kind of anything special like medications or oxygen or equipment. And I think somebody talked about car seat or bed use or had a question on that previously. That's definitely concerns, and there's a minimum weight before babies are discharged, and all parents have to go through kind of mandatory car seat training before they leave with their baby in the car seat. So if there are car seat questions, please let me know. They're also, I think, I think the main crux of this is preparing them and providing anticipatory guidance, really, for what it's like to go home with a newborn, but what it's like to go home with a newborn preemie. What are things you need to be aware of that might be of concern? I think that one of the things are that I think 30% of babies, the preemies that are discharged, kind of have respiratory infections, right? So just kind of helping them recognize the signs of that. What do you do? When do you go to the hospital? What is, how do you know when your baby's not doing well? Helping them feel confident with that. And then really engaging family support services. And I think that's going to be, there are lots of post-discharge kind of support that parents are required to go to. But I don't think that our social support community resources are engaged sufficiently post-discharge, and I don't think it makes it on the list. So I do want you guys to know that these are all the people that could be involved in a family post-discharge, which is a significant number of professionals. And how do I even begin to negotiate this as a parent when I have a newborn at home? It's beyond my comprehension. It was hard enough for me when I brought my newborn home, but now these parents have to go home and have all of these professionals to deal with. It's a lot. I've listed again infants that have risk for neurodevelopmental outcomes. I'm not going to spend too much time on this, but I think these are just families to just kind of are at risk. So the support follow-up after post-discharge is huge. So suggestions for better discharge, I think really having the family feel like they have a medical home, right? A place that they feel like is a doctor and a team that knows NICU babies, that knows their babies' kind of issues, are able to help them follow up, and a medical home that is able to understand what community resources are available. I don't know that how many of our home visitation programs are connected with kind of pediatricians or hospitals. I know Welcome Baby kind of begins the process, but I think a continued presence of home visitors in the home is huge. I know Nurse Family Partnership is wonderful, but that would be some things to how can we begin to have our home visitation professionals be able to kind of intervene and be there is huge. With this, I just want to highlight that all parents go home with a NICU discharge summary. And I think that's a crucial piece of document that not just the medical home or the pediatrician gets when they leave, but it's super important if you are working with a family and they are a NICU family and you're helping them when they're at home, please access and say, hey, did you get your NICU discharge summary? Can I kind of look at it? Do you know where it's at? And call the hospital. Get signed consents to get it if the parents don't remember where they place it. It contains a lot of information about ways to kind of what are the medical pieces to be able to aware of, what are the follow-up pieces that they need to be aware of, and a lot of you could help support the parent in being able to negotiate all the different moving pieces as they leave. So these are some of the questions. I think it's really how do we engage how do we have more of a presence? How do you have more of a presence in the hospital to support families post-discharge, even in the preparation for discharge stage? Are there RNs on your home visitation teams? Is there a way to think about having an RN on your team part-time to be able to support NICU families? Those would be, I think, some of the things to look at. And then how can we show that our home visitation programs have more positive outcomes for NICU families? So I'm going to pause here for questions, Martha. Again, I think I've reflected questions.
Yes, so we do have one, and I am going to just take this moment as a reminder. I can force mute everyone who is not on a phone. If you're on a phone, please mute yourself. We are still hearing background noise, so I want to make sure that to be respectful to Dr. Tan and to everybody else who's listening, that everybody's muted. So please, if you're on a phone, take a second to do that right now. Okay, so then we did get a question that came in. from Denise, which says, with the current pandemic, are there any virtual resources such as support groups for NICU families?
Absolutely. So again, I've listed, sorry for those of you who didn't get the slides, but on the very last resource slide on your slide packet, under NICU parent support, I've listed kind of online support groups that are available at this time. I would say I would direct you to Postpartum Support International, which has NICU parent groups going on right now. But I think also there are online opportunities, especially from places like the Hand to Hold organization online, that can actually partner you with a mentor parent that has been through the NICU with similar kind of medical challenges as your baby. So I would definitely direct you there to kind of get support either from online groups or from a parent mentor. So I know that they're not able to kind of get the in-person support in the hospital at this point. Is there another question, Martha, that I'm seeing?
Yes, there are a couple more coming in. So one from Nancy that says, how do we review the topic of milestones in cases which milestones may be delayed?
Yeah, I think that I would absolutely start to become informed and educated in terms of kind of what the milestones would look like for preemie babies. I think that if there are ways to connect with physical therapists in the hospital in your area to learn about what preemie development looks like, that's going to be huge. So I think milestones should still be covered. I would encourage you to kind of get support for what would be the accurate milestone stage that your individual preemie client family would be at, right? So again, depending on kind of how much corrected age, depending on how premature they were, to kind of what their age is now, there's a way to calculate where they should be at. So they might be, chronologically 4 months old, but they were 3 months premature, so they should be acting like a 1 month old, right? So kind of, I think that it can still be covered, and I'm going to address this question in the at home. How do we support them? Because I think that's a great question. We want to support their development, but we also need to support their relationship. So are there any other questions at this point? Maybe one last one, and then I'll talk about baby at home.
Sure. So there is one more in the chat which says, what are some suggestions for promoting sibling bonding with current visitation restrictions?
Yes, absolutely. So I will be talking about that at the end, but you also have a different handout that I sent you that was an NNP handout on supporting the family and sibling, which gives you some ideas about what to do. I think at the end of the day, it's helping the sibling understand and be connected. I think, at least, I don't know about other NICUs, but at least in our NICU, there are now cameras that are on the babies, so the sibling can see the baby on the internet through those cameras and begin to have conversations about, yeah, your baby sister is here, this is where she's at, what it looks like, and this is what's going on. She's at the hospital, they're helping her body get stronger, or she might be sick and they're helping her. I think that the child life specialists are going to be the people that you would encourage the parent to connect with, because they are a group of specially trained professionals that can help siblings feel included. And I'm going to talk about them later, so just hold on for a second. I'm going to move on in terms of the baby at home. So we know, and this is just kind of a survey from 0 to 3 that talks about parents with birth to 3-year-olds at home. And they are already, so just having a young child at home and a newborn has already kind of have a lot of emotional stress that parents are talking about, just having kind of a young child at home, right? With the pandemic, recent research, and this was just kind of done very briefly towards the end of March, there's also kind of significant stress going on with the coronavirus in families at home. They've talked about more kind of punishment and shouting and putting children in timeout, and kind of talking about it's difficult to kind of put their stress down. So if you think about families in the NICU going home at this time, they're not only going home with a newborn, that is a whole different stress in itself in a normal life stage transition. They are now doing this under COVID stress, under the stress of the pandemic, which amps up the stress. And some parents even stress out about getting the house clean. I know one family couldn't even find cleaning supplies to kind of get the house clean for the baby to come home. And then you have, I think I'm going to talk about some of the stresses that go with actually being at home that parents talk about. So going home, parents talk about it as some parents describe it. One meta-analysis that looked at kind of parents' responses going home, they described it as the most difficult thing they've ever done in their life is to go home and to take care of their preemie baby, right? They have so much to adapt to, because not just the newborn challenges of taking care of the baby, they have to be concerned about feeding and weight gain. They have to be concerned about infections and illnesses. They now have to be nursed. They have to make sure that they know the medical pieces and when to feed and when to give medications. And then they come home to kind of unexpected financial costs due to the baby staying in the NICU. And then like the mom that in the clip that I showed you, a lot of isolation and loneliness, not just from having a newborn at home, not just for having a premature baby that being more careful about, but I think even more so with kind of the current crisis. People can't just show up and offer them a meal or whatever. There's so much going on with the pandemic situation where the people that would be supporting them, like grandparents, might not be taking not taking that risk to kind of do that. And then again, like I said, the concern of developmental delays is huge for parents that are at home with babies from the NICU, kind of the impact of the medical course and kind of prematurity. And then I think they're not expecting how challenging it is in the first few weeks to be home, for all the time that is needed, not just to care, but to coordinate the care, to make it to all the appointments with the clinical subspecialists, whether it's a pulmonologist or the GI doctor. There's just so much follow-up that needs to happen. And then at the base of that is kind of this kind of stress of kind of like, well, now my baby's home and I'm taking care of my baby. The bonding might be kind of there, but they might be so overwhelmed that they can't even bond with the baby. So I think the big thing for you to take away from is that moms are super exhausted. Dads are super exhausted when they go home. This idea of the mom that kind of put a bed in her daughter's room when she first came home and stayed there for months, right? They're so tired and they're so overprotective as parents, because they're thankful that the child survived the NICU and that they're home. They feel the pressure and responsibility of it's all on me. I have to take care of my baby now. A lot of moms talk about, waking up constantly trying to check if their baby is breathing, to see if their baby's okay. So not only are they kind of waking up every 2-3 hours to feed their baby, they're waking up to check if their baby is alive and breathing, or monitors are beeping and waking them up. So they are totally exhausted and sleep deprived. And one study showed that the exhaustion kind of prevails through the first year of life of their baby. So this really going to put the parent under kind of the chronic toxic stress that we're talking about. They're not able to recover from the stress because they're not able to kind of sleep well. So I think what the key thing would be to try to problem solve with these parents about how can you once a week get a significant amount of restorative sleep. That's going to be huge. What can we help you to do that? The other piece is kind of the anxiety. So the overprotective parent, let me just say one more thing. One study talked about a mom saying, we always have to be a little bit better because I'm a preemie mom. So there's this push and motivation and urge, not just to keep their baby from falling sick again, but that I have to do something to make them, even better because they've lost time, as being a preemie infant. I'm feeling guilty about that. And so I need to make up for this. I need to help them be even better, my baby, because I don't want my baby to be behind. And these behaviors of compensating for either kind of that their babies have gone through so much, or that now they're home and I need to kind of help them catch up, can go on for the first 3 years of their baby's life. So the other piece that I want you to be aware of in terms of being at home and kind of holding as you work with these families is this anxiety and fear that goes with not just the baby being sick, about what might happen to the baby, but that this fear is there that's developed in the NICU, and they might be traumatized by that, but they carry this fear, and they can carry this fear for up to 18 months being home with their baby. And so that's really something to think about, something to assess. Just so you know, the incidence of postpartum mood and anxiety disorders is oftentimes 2 to 3 times higher, if not 4 to 5 times higher in NICU parents, especially the idea of PTSD. I think depression was something that the lady in the clip mentioned about, but I want you to kind of be aware to look at PTSD as well. In moms and dads, NICU moms and dads, they're about 15% in moms and 8% in dads, when in the general kind of postpartum population, PTSD is at 3%. So they're really, really at a significant higher rate. That's something to hold and be aware of. Like I said, it's the accumulation of stress. And I think the vulnerability of parents, I think oftentimes I can cope with this. They have resources, but now under kind of, the coronavirus, they're already at a certain level of stress. I come in the NICU, more stress. I go home, more stress. So I think that just to kind of be aware and to kind of be assessing of kind of like what might be mental health concerns that we might need to address that could impact the bonding with the infant. And then I think the idea of moms always focus on one, they put their babies first, oftentimes sacrifice themselves, which leads to relational strain with their partner, but also I think helping them understand ways to help them be with their baby versus kind of like the taking care of and the medical pieces that go with that. I listed a ton of information here about some supportive factors. I think that getting in early and supporting parents early in the first week or two that they're home would be super important. Although I think it's really hard to kind of get to them because they're so overwhelmed adjusting. They have so many appointments to go to. It'll be difficult to have another appointment to have a home visitor show up, but that might be something we could talk about a little bit more. I think if needed, I think families that have children that have a lot of chronic medical kind of conditions, will be helpful to talk to a palliative care provider or team to help them negotiate and understand if they're going to be coming back to the hospital again and again and again. Kind of that is a different sort of stress that goes with that. And I think I listed here too that early intervention. There was a study that showed that early intervention that focused on both infant development, so physical kind of activities to help kind of the physical development, and parent-infant relationship have the greatest impact on cognitive development for preterm infants. So I think always any kind of early intervention that we do to help development, kind of hold in mind how can we help them be aware of the relational processes and to kind of help strengthen that as well would be huge. I want to say real quick about play. We definitely are seeing that parents are spending more time, of course, with their children, and they are spending more time in activities together, but the quality of the interaction, I think, is kind of what I want to highlight. And so I was toying with the acronym PLAY, and I think that at this point, especially with stress, all I've talked about was stress. But I think how do we support sensory motor play is going to be huge. Not just for babies' development, but helping moms and helping parents kind of regulate themselves. So I think not just kind of the type of play, but the quality of play and how do we help the parent be present. So in using the acronym of PLAY, I kind of came up with just maybe some strategies to help the mom, like when you're playing with your baby, I know there's all this developmental things that people are telling you to do to help them get stronger and all of this stuff, but really just pause and try to enjoy the moment, try to laugh, try to smile with your baby. Especially at this time, all the babies are seeing are people with masks on in a NICU. Have them see your smiling face, have them see your face. Be available, be present. What does it mean to kind of be fully there with your baby, right? If the baby needs a little bit more cuddling and you have to feed, or you have to go on to the next task, take the time to be with your baby who needs a little bit more connecting and time to be held. And I think sending the message of you are important. Not just the baby is important during the playtime. How do I send that message that the baby is important? Really kind of focusing attention and helping them kind of read what their baby's intentions might be and be able to kind of help their baby be felt. But I think sending the message that during the play, if they are too stressed and they can't be present, just do their best. But that just means that that as a parent, they are important, and they might need a little bit more time during that day to kind of take a break for themselves, to breathe, to kind of do something that would help them manage their stress. So I just wanted to highlight that I think, especially at this time, sensory motor play that is relational is going to be super important for the parent. So I'm going to go on to siblings for a little bit, and these are some reflective questions that I listed. But I think really what I was trying to get to is kind of is there anything kind of mental health wise that has lingered after their NICU experience? Again, it's going to likely show up when they're home, and how is that affecting them? What has stayed with them from the NICU experience? And then helping them to kind of think about what kind of parent they want to be. How do I get there? And not kind of focusing so much on I'm a horrible parent, I don't know what I'm doing, I can't take care of my baby, or I failed my baby, right? That would be, and I put on there, when was the last time you had fun with your baby? Can you tell me more? So I'm going to pause for a little bit for questions. Martha, are there questions that are on?
Yeah, so one did come in from Carla, and it says, what are some suggestions to promote and support breastfeeding with premature baby?
Again, I'm not a breastfeeding expert. So actually I did a webinar with Breastfeed LA where we did kind of address that a little bit. But I would definitely at this point, I don't know if you're talking about in the NICU or post-discharge. I think that a lot of times even moms that start breastfeeding in the NICU kind of fall off when they go home. So I think some suggestions for supporting breastfeeding, and the issue of breastfeeding and maternal mental health kind of has a connection as well, because a lot of moms stop breastfeeding because they don't feel, they start to feel the stress and they start to feel depressed or anxious. So I think I would say it's twofold. Target kind of both the mental health of the mom, make sure that that's supported so that they have the energy and they're able to kind of continue breastfeeding. But if there are people to connect to in the community that can support their breastfeeding, that's going to be huge. So I know for our hospital, even when families go home, they are able to have post-discharge follow-up with our lactation consultants. So if there's La Leche, I mean, those kinds of resources that you can kind of help support them in doing. I think at the end of the day, it's helping moms understand all of the shame and guilt that goes with kind of breastfeeding. That's going to be, I'm going to kind of go that route and help them know the technical kind of people like lactation consultants that can help them kind of with the breastfeeding part and kind of problem solving, kind of what's going on, in a hold and the logistics of kind of breastfeeding. But I think as home visitors, helping them reflect on, it's just way too much stress for me, right? I can't do it right now. I'm so stressed. And is it okay not to breastfeed? But if I want to breastfeed, I want to do the best for my baby. What are some ways that I can do this? And that moms at the end of the day need to be somewhat regulated to be able to continue breastfeeding, right? And to not give up, Even if I haven't done it, I only do it once a day, why am I even doing this? Like, do you want to keep doing it? If you do, let's find some people that can support you, okay? Are we good? Any more questions, Martha?
Yeah, that's it for the chat for now. Thank you.
Okay, all right. So I'm going to just talk real briefly about support for siblings. Like I said previously, kind of check in with the child life specialist if there are. They are wonderful coaches for parents for what to say to siblings. They have resources like coloring books, and I think I listed some on the slides here, where I think just because they can't physically be there at this point, giving them a sense of where their siblings at. What does it look like in the hospital? What is my baby brother or sister sleeping in is huge. Making them feel a part of the process. So I think there are medals that some people give the sibling, like you're kind of a big sister award, and packages that they give them. But I think at the end of the day, siblings know when parents are stressed. Parents are gone a lot in the hospital. They don't see their parents. Kind of making sure that they feel heard and listened to is going to be huge in the adjustment. So helping them have helping them by making specific scheduled time each week to be with their children that are not in the NICU is going to be a huge way to help them adapt to kind of this new adjustment in life, having a NICU sibling. And I think preparing for discharge at home, how to help the siblings be more involved, help them get prepared for maybe their sibling might have oxygen coming home. I think it's not unlike preparing them for a newborn coming home, but now it might be just helping them a little bit more with some anticipatory guidance about what that baby might look like, that might be equipment, that mommy might be a little bit busy this first few weeks at home because your sister has a lot of appointments at the doctors that we have to go to. But I think at the end of the day, it's sending them the message that you are still loved and important. And how do I help them be involved? And I think I gave you kind of this website that has the handout about how to kind of help an activity that can help kind of the sibling be involved in anticipating when my baby sister comes home or my baby brother comes home, what are some things that I could be able to do with them? And then I think helping them and educating them for kind of just, we need to be extra careful, we need to wash our hands. I mean, those kinds of things, which is going on right now, but especially for a sibling that's coming home from the NICU as well. So here are some questions about, I think at the end of the day, what are your children picking up from kind of you as a parent about having a sibling in the NICU? I think there are special questions about if the sibling's really sick, how do we help support the sibling? Those I think are separate questions that I don't have really time to focus on at this point. And then targeting the support at a developmentally appropriate level.
Hi, I'm sorry. Can everybody please mute themselves? We can hear you. Someone's on their phone. We can hear background noise. So please mute yourself.
So people can already start reserving, which means they are going to open July.
Hi, someone's on the phone. We can hear your side conversation.
The shutdown.
Can you please mute yourself?
Not just without consequences for Disney.
If we can't mute phone callers.
Employees, you know what I mean? Let them go. Not let them go, but like this.
Okay, can anybody hear me now? Great. Okay, Dr. Tan, I muted everybody a bunch, so I think you need to unmute yourself again. Let me find you and unmute you myself. 1 second.
Thank you. I couldn't do it.
Oh, great. Okay, there we go. All right, we found a new trick. Thank you.
Okay, so I don't know if there were any questions about kind of the being at home and supporting families at home. I know I covered a lot and talked really fast. Hello?
So I don't see any more questions in the chat. If anybody has further questions, please do feel free to put those in.
Okay, so maybe I'll just end with some ending thoughts. I think at the end of the day, my hope is that, especially with NICU parents at home, be trauma informed, know that they do carry trauma pieces, even though they might not be aware of it, that there's like secondary trauma while being in the NICU, but also kind of the trauma that they carry, and then being home and being stressed about kind of their babies and kind of worrying all the time that their baby might be sick. And that happens for a while. It can happen a year, 2 years out. Be open to learning about the family's encounters with the medical system and how to kind of letting them tell their story about being in the NICU, about kind of their continued engagement with the medical system, and kind of helping them increase their awareness of how interactions with the system is impacting them. I think especially cultural, I think of the cultural pieces, the language pieces, how to help them to kind of make sense of it and to continue to be assertive and advocate. There's definitely a lot of case management support needed to even navigate kind of the complexities that come with engaging with the medical systems and the insurance systems, and kind of all that they need to access the medical support that they need for their baby. A lot of times with the medical insurance pieces are a significant source of stress, and being able to get the right insurance to be able to see the right doctor. So I think that will be huge. Support the parent-child relationship as much as the developmental activities is going to be one that I think stressed a lot. And then at the end of the day, empower parents to be advocates for their child. And I would add to that to be to take the time for self-care, to take care of themselves, because it is a significant amount of stress to be home with a newborn from the NICU. So I'm going to kind of leave a little bit of time. I think we have about 5 minutes for questions or comments. Anyone that kind of has thoughts about, I think, how do we continue to have programs like Welcome Baby be more engaged with, I think, with NICU families? How do we start to build bridges between hospitals and, I think, home visitation programs would be, I think, my thought about how can we, what are the next steps, I think would be some of the thoughts that I'm going to leave you with.
Thank you, Dr. Tan. We do have one more question that came in, which is how can partners play a role in supporting moms? Or if you have any ideas about how to engage partners and others who are supporting moms.
Yeah, I think that I think I didn't mention it before, but I think the partner support is huge. And letting them know, I think letting partners know how important their support is. I think that moms, in one study, moms reported when they got support from either NICU moms that have graduate NICU babies, from their partners, from their families, early on when they're home. I want to say like first week or two at home, it really helped them feel more confident about their ability to care for their baby. So I think helping partners understand, first of all, the stressors that might be going on for moms. Oftentimes moms that feel super responsible when the baby is home, and their stress levels kind of go through the roof. So I think a lot of partners, one study talked about fathers kind of being mother assistants, but really just kind of helping partners understand, you know, maybe helping the partner and the mom together negotiating their roles as parents and how moms could feel supported by their partners. But I think also to highlight how important the support from the partner is, right? In helping moms feel more confident and supported in being able to care for their baby. So I think that's going to be, it's huge. Partner support is huge. And I think if we begin to engage and help the partners see that they do have an impact, right? That their connection with the baby is just as important. And in fact, when they do feel connected to their baby and help to kind of take care of their baby, it gives mom a little bit of relief to know that there's someone just as interested, someone that's just as confident in being able to take care of my baby, which might help mom, you know, be able to rest a little bit.
Thank you. That's really helpful.
Mm-hmm.
Yeah, any further questions for Dr. Tan? We have a great opportunity to ask questions now. So if you have any, please do put them in the chat. And it looks like Steve, thanks Steve, has a resource in the chat from the ongoing March of Dimes webinar series. So please do check that out if that's interesting.
Mm-hmm.
We do have a question that just came in from Carla.
Mm-hmm.
It says, Regional Center, are premature babies automatically linked to RC or only when there are other problems, for example, Down syndrome?
As far as from what my understanding is, I don't think they are automatically linked. They are referred, some of them are referred and recommended, but the parents still need to follow up. So Regional Center might reach out to them, but oftentimes the parents are so overwhelmed, they don't respond, and oftentimes Regional Center services kind of are dropped because just there's no follow-up. So what we're finding, especially in our high-risk infant clinic, is that, you know, a couple months out, first of all, they're not following up as much with the high-risk clinic, and then they're not actually connected to regional centers. So that, again, is a huge case management advocacy piece in terms of helping parents understand that there are regional center services available and how to access that. It's going to be huge. So thank you for that question. I think, again, just there's so many resources out there, but it's just not a way to coordinate and be aware of you know, what are the different resources that a NICU baby could access after being home. As you're talking, I want to highlight on your resource page that there are staff training opportunities for supporting and understanding NICU families at National Perinatal Association or nationalperinatal.org. There are actually a series of staff education series. So if there are programs that are interested in more specifically supporting NICU families, I would definitely encourage you to look up that. That might be kind of staff training that might help you kind of train staff to be able to see and help NICU families. Anything else, Martha? I think we're coming to time.
Yeah, that's the last question that I see in there. So thank you so much for this opportunity. I am going to put an evaluation in the chat right now. If everybody could please take the time to fill it out. It's really short, but it'll help us a lot. So thank you, Dr. Tan. We'll give you a very muted round of applause, but this was a great webinar. We really appreciate you taking the time to talk through this with us. Thank you.
All right, excellent. Thank you so much.
Great, and I will send out those handouts again to everybody. If you don't get them by tomorrow morning, please email me and let me know. Thank you, Dr. Tan.
Thank you, everybody. All the best.
You too. Thanks so much.